Hey Dad, do you reckon I can have a drink too?
What would you do in a situation like this? Alcohol is a serious problem. At some point in their lives, 87.9% of Australians 14 years and over have tried alcohol. It's astonishing to know that 7.2% of Australians drink alcohol daily. It's the most widely used drug in Australia and it's legal. In 2010, alcohol abuse alone cost society $14 billion. So why is it that we drink? Well, there are many reasons. It may start from peer pressure or curiosity, but we continue to drink because essentially it changes our mood. The first impact of alcohol is rapid. Within the first 90 seconds of entering the bloodstream, a swake enters the brain. There it increases the firing rate of pleasure chemicals like dopamine and endorphins, the effect that provides the high. As a result, we may become more sociable, have more confidence, and are much happier. But what happens when it becomes a habit? In its absence, we begin to lose the feelings associated with the activities we like doing. Soon enough, it becomes part of every day and every activity. One becomes enslaved to the practice of incorporating alcohol in everyday activity to such an extent that its cessation actually causes trauma. That is alcohol addiction, and it can affect more than you think. It impacts your body, your life, even your family. Chronic alcoholism will lead to organ damage affecting your liver, heart, pancreas, or brain. The difference between a normal 43-year-old's brain and a typical 43-year-old alcoholic's brain is outstanding. The brain actually shrinks in size, and damage can lead to very severe psychiatric complications such as schizophrenia or bipolar. It also takes quite a toll on the family. Arguments can erupt out of nowhere. Just have a look at this family.
For what you've done enough, you're no longer needed.
However, if you found yourself trying to make a recovery from alcoholism, you're not alone. There are many tools to help you on the way of recovery. If you're thinking about getting sober and staying that way, antabuse, also known as disulfiram, may be your answer. What better way to stop drinking than by making alcohol consumption unpleasant? I'll show you how it works. Alcohol gets broken down by alcohol dehydrogenase in your liver, forming the toxic metabolite acetaldehyde. This is the chemical responsible for the hangover effect. Normally, acetaldehyde is broken down to acetic acid by acetaldehyde dehydrogenase. But the enzyme can only work so fast and can be overloaded by a night of heavy drinking. Disulfiram works by inhibiting this enzyme, causing a buildup of acetaldehyde. Hence, if you're on disulfiram, you're not really going to want to drink. It'll give you a massive hangover effect and you'll probably end up like this guy. Or worse. It's definitely not recommended. Best to keep it out of the equation. Studies have shown that it really increases your chance of staying sober. And it's only one pill a day, so it's not much of a hassle. Though there are some problems. Disulfiram merely acts as a physical and psychological deterrent to someone trying to stop drinking. It does not reduce the person's cravings for alcohol, nor does it treat any withdrawal symptoms. For this reason, disulfiram cannot be taken within 12 hours of a drink and should only be administered to those actually sober and have overcome the withdrawal symptoms. Alcohol dependence is a major issue with recovering alcoholics. So if you're itching to have that drink, acamprosate is a drug that can help. It reduces cravings by acting as an antagonist at the NMDA receptor and an agonist at the GABA receptors, same receptors that alcohol activates, that's responsible for that craving. Studies have also shown that it can be used with disulfiram to improve treatment outcomes and reduce relapse. It should, however, be given 3 to 5 days after withdrawal to minimize confusion between withdrawal symptoms and adverse effects. Naltrexone is another drug shown to be promising for a recovering alcoholic. It prevents that high effect when you consume alcohol. It competes with alcohol at the mu receptor, however, instead acts as an antagonist. You only need to take it once a day, so it's quite convenient. However, if you have a drug problem with opioids, you should definitely avoid this one. It can bring out withdrawal effects in addicts. This drug can be used with acamprosate, but not with disulfiram. Both those drugs can cause liver problems, so it's best not to combine them. Pharmacotherapy should be considered for all alcohol-dependent patients following management of withdrawal. They are best used in association with psychological support as part of an aftercare treatment plan. Get your life back on track. It's time to get sober.